Hello and welcome to Wally's Nursing Videos, your go-to channel for all things nursing and healthcare education. Today, we have an informative and comprehensive lecture on hematology, a subject of paramount importance for nursing students and healthcare professionals. Whether you're a nursing student eager to expand your knowledge or a seasoned nurse looking to refresh your understanding of hematology, you're in the right place. We'll explore blood values, anemia, clotting disorders, and much more. So, grab your notepads and let's dive into the fascinating world of hematology. Blood values. Blood values are measurements that reflect the composition and function of blood. These values are critical for assessing a person's overall health and diagnosing various medical conditions. Normal ranges for platelets. Platelets are small blood cells that play a crucial role in blood clotting. The normal range for platelets is between 150,000 and 450,000 per microliter, K microliters. Normal ranges for red blood cells, RBCs, are responsible for carrying oxygen throughout the body. The normal range for RBCs is 4.5 to 6.0 million per microliter for men and 4.0 5.0 million per microliter for women. Perfusion. Perfusion refers to the process of delivering oxygen and nutrients to tissues and removing waste products from them. It's a vital aspect of maintaining tissue health and function. Clotting. Clotting, also known as coagulation, is the body's natural process of forming clots to stop bleeding. It involves a complex cascade of reactions that result in the formation of a stable blood clot. Now let's explore different mechanisms and types of anemia. Mechanisms of anemia. Anemia is a condition characterized by a decrease in the number of red blood cells or a decrease in the amount of hemoglobin in the blood. There are two main mechanisms. Not enough clotting factor. This can lead to bleeding and anemia. Too much clotting factor. This can cause clot formation and reduce blood flow. Types of anemia. There are several types of anemia, each with different causes and clinical manifestations. Let's discuss a few common ones. Iron deficiency anemia, caused by a lack of iron which is essential for hemoglobin production. Thalassemia, minor-major, a genetic disorder that affects hemoglobin production. Megaloblastic or pernicious anemia, often due to a deficiency in vitamin B12, cobalamin. Anemia of chronic disease associated with chronic inflammatory conditions or infections. Anemia from acute blood loss results from injuries, surgeries, or other acute bleeding events. Anemia from hemolysis involves the destruction of red blood cells, often seen in conditions like sickle cell disease. Clinical manifestations of anemia. Anemia can present with various clinical manifestations depending on its type and severity. These may include pallor, jaundice, fatigue, weakness, shortness of breath, dizziness, rapid heart rate, bone pain, numbness. Now let's discuss nursing care for iron deficiency anemia. Nursing care for iron deficiency anemia. Identify risk factors such as poor diet or chronic blood loss. Encourage an iron-rich diet. Administer iron supplementation, considering taking it with acidic food, e.g. citrus juice. Educate patients on iron replacement therapy. Emphasize safety, especially when using liquid iron. Use a straw to prevent teeth staining. Provide bleeding, bruising precautions. Educate patients and their families on dietary changes to maximize iron absorption. Discuss the need for diagnostic studies to identify the cause of anemia. Emphasize compliance with dietary and drug therapy. Monitor patients on lifelong iron supplementation for potential liver problems related to iron storage. Iron deficiency anemia treatment notes. Iron is best absorbed as ferrous sulfate, Fe2+, in an acidic environment. Taking iron with vitamin C or foods containing ascorbic acid enhances iron absorption. Liquid iron can stain teeth, so it should be ingested through a straw. Iron supplementation can cause constipation, so patients should be started on stool softeners and laxatives and increase fluid intake if needed. Next, let's look at anemia of chronic illness. Anemia of chronic illness, associated with cytokine release, which retains iron in macrophages. Commonly found in chronic inflammatory conditions, autoimmune disorders, infections, HIV, malaria, hepatitis, malignancies, and heart failure. It often presents as mild anemia, but can worsen as the underlying disease progresses. Differentiating anemia of chronic illness, treatment should focus on addressing the underlying condition. In some cases, blood transfusion may be necessary. Erythropoietin, EPO, may be cautiously used. Modify activities and consider dietary adjustments. Now let's discuss anemia from acute blood loss. Anemia from acute blood loss. Common causes include trauma, surgical complications, or other sudden bleeding events. Assess for volume loss and the risk of hypovolemic shock. Even with minor, gradual blood loss, there may be a significant drop in hemoglobin and hematocrit over time. Assessment of acute blood loss. Assess for pain, pallor, cold, clammy skin, tachycardia, tachypnea, hypotension, and other signs of bleeding. Pay attention to the location of bleeding and related symptoms. Medical management. Laboratory tests and blood bank involvement are crucial. Surgical consultation may be necessary for severe bleeding. Nursing interventions for acute blood loss. Prioritize ABCs, airway, breathing, circulation. Identify the cause of bleeding through thorough assessment. Consider oxygenation needs. Provide volume replacement through venous access. Common blood products for replacement include crystalloids, packed red blood cells, plasma, and platelets. Consider calcium needs. Implement the transfusion reaction protocol for nurses. Long-term care may involve iron replacement and identifying the cause of bleeding. Now let's delve into destruction of RBCs, anemia from hemolysis. Destruction of RBCs, anemia from hemolysis. Hemolysis can be intrinsic, often hereditary, or extrinsic, resulting from physical destruction, antibody reactions, infections, or toxins. Sickle cell disease is a common example of intrinsic hemolysis. Care for individuals with hemolysis focuses on preventing dehydration, managing tissue oxygen needs, and preventing infections. Other RBC disorders, polycythemia vera. Polycythemia vera is a myeloproliferative disorder characterized by an overproduction of red blood cells, leading to increased blood viscosity. Symptoms may include vertigo, headache, pruritus, angina, and more. Nursing interventions involve phlebotomy, monitoring I&O, myelosuppressive agents, nutritional assessment, and supportive care. Now let's discuss aplastic anemia. Aplastic anemia. Aplastic anemia occurs when the body fails to produce enough new blood cells, making the individual prone to infections and uncontrolled bleeding. Clinical manifestations include fatigue, shortness of breath, bleeding, and infection. Causes can include exposure to toxic chemicals, certain medications, autoimmune disorders, and viral infections. Risk factors for aplastic anemia: treatment with high-dose radiation or chemotherapy for cancer, exposure to toxic chemicals, use of specific prescription drugs, certain blood diseases, autoimmune disorders, and infections. Pregnancy, rarely. Prevention and diagnosis. Prevention is challenging, but avoiding exposure to certain chemicals and toxic substances can lower the risk. Diagnosis involves blood tests, including hemoglobin and platelet counts. Now let's move on to thrombocytopenia and deep vein thrombosis, DVT. Thrombocytopenia. Thrombocytopenia is a condition where there is a reduction in platelets, leading to abnormal hemostasis, causing bleeding or spontaneous bleeding. It can be acquired and is often linked to medications and drug-induced antibody reactions. Nursing care for thrombocytopenia. Monitor vital signs and look for signs of bleeding. Assess for pain, bleeding, and other symptoms. Monitor for the use of medications that may affect platelet counts. Educate patients on OTC medication use, especially aspirin-containing products. Monitor blood counts and coagulation studies, D-dimer, PT, APTT. Now let's discuss heparin-induced thrombocytopenia, HIT. Heparin-induced thrombocytopenia, SHIT. HIT occurs when patients develop thrombocytopenia 5-10 days after starting heparin therapy. It is an immune-mediated response that results in premature platelet destruction and thrombus formation. Clinical manifestations are similar to those of thrombocytopenia. Medical management of HIT. Discontinue all forms of heparin, including flushes. Start the patient on a direct thrombin inhibitor. Begin warfarin when the platelet count reaches 150,000 ml. Use additional treatments such as plasmapheresis and thrombolytic agents for severe clotting. Now let's discuss thrombembolism and deep vein thrombosis, DVT. Thrombembolism, DVT. DVT is a condition where blood clots form in deep veins, typically in the legs. Risk factors include venous stasis, endothelial damage, and hypercoagulability of blood. Nursing management for thromboembolism. Monitor labs and make prompt changes as needed. Watch for complications of thromboembolism, such as shortness of breath and changes in mental status. Focus on prevention, as VTE is a major hospital-associated risk. Prevention and diagnosis. Prevention involves measures like graduated compression stockings, early mobilization, and anticoagulants. Diagnostics and labs include H&H, platelet count, D-dimer, and coagulation studies. Medical treatment for DVT. Medication therapy typically involves heparin with a bridge to Coumadin or other long-term anticoagulants. Surgical intervention may be required, such as venous thrombectomy or IVC filter placement. Nursing care for DVT. Monitor labs and make prompt changes based on the order set. Keep a close eye on complications and provide patient safety. Focus on prevention and educate patients about the importance of lifestyle changes, such as smoking cessation and weight management. And there you have it, folks. We've come to the end of our lecture on hematology. We hope you found this information valuable and informative. If you enjoyed this video, don't forget to give it a thumbs up and subscribe to our channel for more engaging content on nursing and healthcare. If you have any questions or topics you'd like us to cover in future videos, please leave them in the comments below. Remember, knowledge is power, and as nursing professionals, continuous learning is essential. Thank you for joining us today, and we look forward to seeing you in the next video. Stay curious, stay caring, and keep up the great work in your nursing journey.